Snoring is the sound that is actually made when your uvula and your soft palate vibrate together, and that's what makes that snoring sound. But it is indicative of a narrowing of your airway pathway. So snoring is often a symptom of sleep apnea, but you can snore without sleep apnea. But it is often a first sign that people are able to identify that there is an airway issue, and that's why when someone snores, it's a really good idea to actually make sure that they do not have sleep apnea. It's always better to rule that out. A lot of people actually think snoring is quite normal, and everyone thinks it's just a thing that happens, and particularly happens as you get older, but no one really wants to investigate it because I think that's just part and parcel of growing older. And a lot of people just think, oh, as you get older you get more tired, you don't feel as good as you used to. But it really isn't. There is always an underlying reason for why there is a change in how you're feeling, and the fatigue and the tiredness that one may be feeling. So it really should be investigated. And anyone who does snore, particularly children, really always should be investigated for sleep apnea. More than 2% of children actually do suffer from sleep apnea. And what that basically means is that that child is not able to breathe as well as they should do, which in effect has so many repercussions, not only on their growth, but also neurological development, just their overall well-being. Children are sometimes misdiagnosed with things like HAD, and there's just so many different things that children are said to be, but it simply could be because they have sleep apnea. So that's why children should always be investigating. In fact, no child should ever snore. They really should be investigated for sleep apnea.